The Doctor's Journal, brought to you by Cetaphil, the Air Institute, St. Augustine Surgical Center, The Best Toys, and Jameson.
Acne. It's not just a skin issue.
That's right. Join us as we uncover the impact acne can have on everyday life and explore effective treatments to restore your confidence and comfort.
Welcome to the Doctor's Journal, where we delve into health topics that matter. I'm Dr. Mike.
And I'm Dr. Sue Ryan. Today, we're tackling a topic that affects millions worldwide, acne.
Or acne vulgaris. It's a common skin condition affecting people of all ages.
Globally, it's estimated that over 85% of people experience acne at some point in their lives, with the highest incidence being between the ages of 12 to 24. Studies also show that when acne appears during teenage years, it is more common in males. However, when acne continues in adulthood, it's more common in women.
Now, acne typically occurs when the skin is clogged with oil and dead skin cells, leading to the formation of blemishes.
It really doesn't make us cute or confident.
True. Now, anyone can get acne, and certain factors like hormones, genetics, and lifestyle choices can increase the risk.
Hormonal changes during puberty, menstrual cycles, pregnancy, and menopause often trigger acne flare-ups, making adolescents and women more susceptible. You may be wondering, why is this right? Well, these hormonal changes can lead to an increase in sebum or oil production. And as we mentioned, oil and dirt can get trapped, creating the perfect environment for acne.
Now, genetics also play a significant role. If your parents had acne, you're more likely to experience it too. Additionally, bacterial infections, excess oil production, and certain medications and dietary factors may also contribute.
Also, Dr. Mike, there are also some contributing factors that may not directly cause acne, but can irritate the skin and make acne worse, such as stress and environmental irritants such as pollution and high humidity.
Now, squeezing or picking at blemishes and even scrubbing your skin too hard may make acne worse.
It's also tempting to do it, though, right?
It's true.
But acne isn't a one-size-fits-all, right? What would work for me might not work for you, or it might not work for your family members as well. So you might be asking yourself, but she used it, my sister doesn't, have any problems with it. Why do I?
Well, it may help to understand how acne occurs in the first place. So naturally, the sebaceous glands in our skin make sebum or oil that empties onto the skin surface through the pore. This is an opening in the follicle. Now, keratinocytes are a type of skin cell which then line the follicle. Normally, as the body sheds skin cells, the keratinocytes rise to the surface of the skin.
However, when someone has acne, the hair, sebum, and keratinocytes, instead of rising to the surface, they stick together inside of the pore. The mixture of oil and cells allows bacteria that normally live on the skin to grow in that plugged follicle and cause inflammation.
This is when we experience some of the symptoms like swelling, redness, heat, and pain. But guess what? It doesn't just stay isolated. When the wall of the plugged follicle breaks down, it spills the bacteria, skin cells, and oil into the nearby skin, creating lesions or pimples.
There are also different types of acne, each with its own signs and symptoms, from mild comedonal acne to severe cystic acne. Understanding the type can guide treatment decisions.
When we come back from this short commercial break, we dive even deeper into the skin condition. Don't go anywhere.
Hi, my name is Sasha, and today I'd like to talk about the role that Cetaphil can play in treating acne patients. For the acne patients, I want to highlight our Cetaphil Derma Control line, which includes the Cetaphil Derma Control Oil Removing Foam Wash and Cetaphil Derma Control Moisturizer with SPF 30. This line is designed to play a supportive role in the skincare routine of an acne patient. The Cetaphil Derma Control Oil Removing Foam Wash is a deep cleansing formula that gently removes pore clogging impurities, makeup, and excess oils. It is formulated with zinc technology to reduce surface oil and shine while calming and soothing the skin. The Cetaphil Derma Control line is hypoallergenic and non-comedogenic, meaning it won't clog pores or irritate the skin, making it the ideal cleanser and moisturizer for acne-prone oily skin.
Are you looking for a customizable studio space with green and white screen cyclorama and professional production equipment to carry out your next big project? SGP Studios is the perfect fit for you. TNT's largest studio space with an overhead lighting grid and sound treated, perfect for television commercials, music videos, television programs, social media content, and film productions. We also have a wide range of production equipment available for rental. You can choose from a selection of Netflix approved cameras, modern lighting equipment, professional audio gear, 40-foot and 20-foot cranes, gimbals, drones, lenses, action cameras, and more, all at competitive prices. Whether you need a high-end cinema camera for a feature film shoot, specialized lighting equipment for a music video, or audio gear for a podcast, we've got you covered. And with our easy online booking system, you can reserve the gear you need in just a few clicks. Check us out online at sgpstudios.com.
The best for your baby is at thebesttoys.com. From the best strollers, car seats, baby carriers, high chairs, booster seats, rockers, jumpers and bouncers, walkers, baby blankets, feeding accessories, bathtubs, gyms and playmats, playpens, cribs, baby swings, changing tables, diaper bags, clothing and accessories, and the widest range of educational toys. We carry Infantino, Dr. Brown, Avent, Graco, Chico, Fisher-Price, VTech, Leapfrog, Disney Baby, Delta Children, Medela, and Twist Shape. Visit us in-store at Forces Flagship McBean. Shop online now at thebesttoys.com. No credit card required. Free delivery throughout Trinidad and Tobago on orders over $300. Cash or links on delivery. Order via call or WhatsApp at 332-BABY. And remember, we have the best toys at the best prices.
Thank you for sticking with the Doctor's Journal. If you are now joining us, we are discussing acne. And don't worry, you can always catch up on what you've missed out at the Doctor's Journal TT. Now, acne can present in different ways. You can experience open comedones, otherwise called blackheads, and closed comedones, also referred to as whiteheads. These are non-inflammatory acne lesions.
We also experience papules, which are small, red, raised bumps that might be tender to touch.
Now, then we may have pustules, and these are pimples with a visible white or yellow center, which is caused by the presence of pus. So we can see the oil here and the pus-filled cavity along with debris and swelling at the top.
Yep. There are also nodules, large, painful, solid lesions located deep within the skin, and cysts, which are deep, painful, pus-filled lesions that can lead to scarring and what we see as dimpling in the skin.
Have you ever experienced any of these? If the answer is yes, then your acne may fall into one of the following categories. Let's go. First up, we have fungal acne. This type occurs when the yeast builds up in your hair follicles. They can be itchy and inflamed.
Next, we have cystic acne. This type causes deep, pus-filled pimples and nodules that can cause scars.
Then we have hormonal acne. This affects adults who have an overproduction of sebum or oil that clogs their pores.
Another type is nodular acne. This is a severe form of acne that causes pimples on the surface of the skin and tender nodules and lumps under your skin.
Now, it's very crucial to tailor treatment to the individual, considering factors like severity and skin type. So how severe can acne get?
Dermatologists rank acne by severity. Grade 1 is considered mild and mostly whiteheads and blackheads, with a few papules and pustules.
Grade 2 is moderate or pustular acne. Here we see multiple papules and pustules, mostly on your face. While grade 3 is considered moderately severe or nodulocystic acne. If your acne is grade 3, you will have numerous papules and pustules, along with occasionally inflamed nodules affecting your back and chest as well.
Now, grade 4 is severe nodulocystic acne. At this grade, you will experience numerous large, painful, and inflamed pustules and nodules. And at every stage, we would also recommend seeking advice from a qualified dermatologist. This is so that we can prevent hyperpigmentation, scarring, and dimpling of that skin.
Now, acne can also affect emotional well-being, leading to anxiety, depression, and low self-esteem, especially in adolescents. When we come back, we hear from an expert in skincare.
Hello viewers, I am Onella Selena, a registered dietitian and a nutritionist for Jameson, committed to supporting your health journey. Today, let's explore how nutrition and lifestyle choices can support skin health and overall wellness. Maintaining healthy skin is essential not only for appearance, but can help to improve your overall mood. Foods rich in antioxidants such as citrus fruits and leafy greens can help to protect skin cells and damage caused by free radicals and promote a youthful appearance. Additionally, consuming B vitamins like biotin can help maintain skin hydration and elasticity, as it helps in the formation of fatty acids that nourish the skin. Consume a healthy diet to support overall skin health and stay connected with us via the Ask the Expert program.
There are so many different treatments for acne. That's why it's imperative that you see a specialist, and we are going to today. Hello, Dr. Dean.
Hi, Dr. Mike.
Are you ready for us today?
Yes, and I'm now about to start an acne treatment, so come on in.
Excellent. So tell us a little bit about what we are going to see today.
So today we are going to be doing a chemical peel for my patient. So if we get a closer look at his skin, we can see that he has a bit of acne scarring, as well as hyperpigmentation. And chemical peels are very effective in treating all of these conditions. Now, there are several different types of chemical peels. There's light, medium depth, as well as deep chemical peels. But what's important for our viewers to know is that it is imperative that you go to a medical professional for some of these medical grade peels, because some of them may have side effects as well as contraindications, and it's best treated by a doctor. So I'm going to glove up and then we can get started. So the patient has been washed and prepped. We're just going to do a minor cleanse as well, just to make sure that everything is okay. So Javon, while we're doing this, I just want to ask you again, do you have any medical conditions?
No, doctor.
No? And no allergies or anything like that, right?
No.
And it's always important that we find out if a patient is allergic to any of the ingredients, if they have any medical histories, if it's a female, if she's pregnant or planning to become pregnant, because all of these things need to be taken into consideration when we are looking at chemical peels. It is a relatively common procedure. I would say that it's more along the lines of a cosmetic procedure as opposed to a dermatological procedure. You have a hyperpigmentation scar here. You know you got that? No?
So what are some of the realistic expectations one can have after this procedure?
So what we usually expect to see in a patient is that their skin will be a lot brighter. The areas of hyperpigmentation will be markedly reduced, as well as the areas where they have acne flares will also be markedly reduced.
Great.
So this is the peel that we are going to be using today, and I've already explained the procedure to our patient, so he knows what to expect. So as we can see, he has a bit of acne scarring as well as some full-blown acne pimples and little areas of hyperpigmentation scattered throughout his skin. We're gonna start the peel now, right? You can put it on your face.
I feel like.
So this is going to have a scent, right? You are going to smell it.
It feels cool.
Yeah. You're gonna feel a little bit of tingling at some point, but don't worry, that's normal. So usually with a peel like this, we would do a few layers on the skin. So this would be his first layer, and then we'll go into other layers afterwards. And he also has post-peel protocols to follow, which we will explain to him afterwards and ensures that he understands.
And how long does this procedure generally take?
So this procedure would take anywhere between 15 to 20 minutes, depending on a lot of different factors. If the patient has cleansed prior, or of course the skill of the practitioner.
Right.
Yes, and that's it. It's just as easy as doing a little 30-minute procedure, and 7 days later he's going to have nice bright new skin.
Wow. Well, this looks simple enough to me. Thanks so much, Dr. Dean, for sharing your time and experience.
But of course.
Stay tuned for more from the Doctor's Journey. At Athena Clinic, we're committed to helping you boost your confidence and live your best life. Enhance your appearance with a non-surgical procedure or optimize your health with one of our expert doctor consultations and diet and fitness plan. Call today at 282-2262.
Sneezing, sniffling, scratching? Reacted to your favorite food? Think it might be allergies? We at Allergenics provide personalized diagnosis and treatment for food, drug, contact, and aero allergens. Call us today at 480-4362.
I'm Nandini Samuel, registered dietitian, and today we'll be talking about how your dietary habits can trigger acne. It is important to remember whatever we put into our bodies will have an impact on our overall health, internally and externally. A very high-fat diet that consists of high glycemic index, processed sugary and salty foods can affect or lead to acne. In some cases, other foods such as milk, cheese, certain meats or additives can trigger acne, but this can differ from person to person. Each person's body is different, and what may affect you may not always affect another person. Research shows that probiotics can reduce skin eruption, scars, and redness alongside a well-balanced diet, as this helps to improve gut bacteria. Today we will be making a green smoothie using fruits and vegetables, which is personally my favorite smoothie. So here we have cucumbers, apples, celery, pineapples, and ginger, and of course water. So firstly, we are going to add some fresh pineapples. It's very important that we use fresh pineapple, guys, because the rest usually in cans is very high in syrup, which is basically sugar. Then we add 4 stalks of chopped celery, 1 whole apple, 1 small piece of ginger, and an entire cucumber. I personally love cucumbers, so I tend to add a bit more. However, you can stick to 1 cup or 1 small cucumber. Then lastly, we want to add at least 1 cup of water. What I personally like to do is blend everything together without ice because I prefer use cold fruits. However, there's an option where you can add ice. Juicing is also an option, but preferably it adds more fiber when you blend everything together. So let's taste it. This is definitely amazing.
Whether you're now going through puberty or well into your adult years, we all want clear skin, right? Well, to achieve this, consult with your dermatologist for a personalized plan tailored to the specific condition and skin type.
Remember, patience is key, and many of these treatments require time to show significant improvement. Everyone experiences acne differently, but there are ways to manage symptoms and regain confidence in your skin.
Until next time, take care of you for us.
The Doctor's Journal, brought to you by Cetaphil, the Air Institute, St. Augustine Surgical Center, The Best Toys, and Jameson.